Cover another important history station in MRCPCH clinical examination, cerebral palsy. We need to ask about the onset, how it was diagnosed, how it is progressing, how long this patient is suffering from this problem. Cause could be perinatal asphyxia due to leading to a hypoxic ischemic encephalopathy, intraventricular hemorrhage, sepsis, hypoglycemia, neonatal jaundice. And it is very frequently associated with preterm labor, difficult delivery, torch infection. Complications are visual loss, hearing loss, epilepsy, mental retardation, malnutrition, dystonia, contracture, fracture, prone to abuse, failure to thrive, chronic lung disease, any feeding problem, scoliosis. Important history you have to take in relation to CNS as well as CVS, respiratory, and GI system. And you need to ask about the wee and poo. In past history, we have to ask about any recurrent hospital admission, past surgical history in relation to peg feet, fundoplication, tender release surgery, fracture, dislocation. Past admissions, ICU admissions, and what are the investigations done so far. MRI, CT scan, visual and hearing test, blood test, torch screening, EEG, metabolic screen, chromosomal analysis. Treatment, we have to ask about what are the treatment this patient is on, like antiepileptics drugs, muscle relaxants, baclofen, botox injections. We need to ask about the compliance and complications of using those drugs. Consultants follow up, basically this is a multidisciplinary approach. So community pediatrician, GP, neurologist, dietitian, physiotherapist, occupational therapist, psychiatrist, speech therapist, orthopedics, eye, ENT consultants are involved. Birth history, we need to take detailed birth history. Is there any use of drugs or any exposure to infection happen during pregnancy? And how is the natal history, whether the patient born at term or preterm? How is the mode of delivery? History of any perinatal asphyxia, hypoglycemia, intraventricular hemorrhage. Postnatal history, neonatal jaundice, intraventricular hemorrhage, HIE, meningitis, sepsis, NICU admission. Immunization, whether this patient is vaccinated with pneumococcal vaccine or any winter vaccines like RSV. Nutritional history is very much important, whether this child, how this child is fed, uh, either by means of NG2 feed, pig feed, or any high calorie diet. Development history, you need to ask about the gross motor, fine motor, speech, and social the milestones. An additional question to be asked in relation to vision or hearing, change of head size, any skin markers, feats, loss of acquired skill, language at home, sign language, and any diagnosis has been made so far or not. Pubertal history, allergy history, and family history of similar illness, any major illness, consanguineous marriage, uh, family, you need to draw the family tree and how is the family dynamics. Social history is immensely important. You need to ask whether this child is going to school or any special school. Is there any history of bully, any loss of school days? How is the condition at home? Any education, healthcare plan, social support, disability living allowances this child is getting or not? Any support group, and how this disability affecting this child's life, how this disability affecting the family.